Late Night Health continues. I'm Mark Allen. During hour two, we're going to hear from Daryl Wayne and me. We'll have a chance just to chit-chat back and forth, talking about health and concerns, and that'll happen during hour two of Late Night Health. Right now, we go to the desert. We go to Palm Springs, and we're going to speak with Eric Presser. He is the author of a new book coming out, I think, in about a month or so, An Empowering Guide to Lung Cancer. Dr. Presser, welcome to Late Night Health. Are we seeing more lung cancer today than we did, say, even 10 or 15 years ago?
Well, first of all, I'd like to say thank you for having me on the show, and it's a pleasure to speak with you. Lung cancer is the number one killer of all cancers, not just in the United States, but in the world. It kills more people than colon, breast cancer, and prostate cancer combined.
Oh, my.
And if you're talking about new cases, there are about 225,000 new cases of lung cancer diagnosed each year, with over 150,000 deaths. Now, the reason why lung cancer, obviously, has reared its ugly head is because a lot of people realized how expensive it is to treat. And unfortunately, when I give my lectures and I ask people who have been exposed to lung cancer or know someone who has lung cancer, everyone's hand goes up. And that number is even exponentially goes up when I ask them if they know someone who has smoked or is a smoker. We're also able to diagnose lung cancer earlier now, which is why over the last 3 to 4 years, lung cancer screening has been such a hot topic, which is really one of the reasons why I decided to write this book.
Growing up in the 60s and being told how bad smoking was, I remember seeing pictures of healthy lungs and those lungs of smokers, and I think I smoked a cigarette once. I turned green, and that was it. I couldn't understand it. It was just awful. It was terrible.
And you're one of the few.
Yeah.
About anyone that comes into my office who's over the age of 55 or 60, I don't ask them if they smoked. I ask them how much they smoked or when they tried smoking, just like you. I mean, carrying a pack of cigarettes was like carrying an iPhone nowadays.
Yes.
And it's
and about the same size.
It really is. And the information that you're referring to really wasn't given out as far as the entire public was concerned, for obvious reasons. No one who's making money, for example, the cigarette companies are going to sit there and put out ads like we see today. But nicotine is so addicting, okay? I mean, studies show that it can be more addicting than cocaine or even heroin.
It's right up there with sugar.
And sure, absolutely. I mean,
Right.
Look at the obesity problem in America.
So, working in advertising like I have, there's the disclaimer on each pack of cigarettes. Smoking may be hazardous to your health. I don't remember the exact wording. And I read a study years ago that it was supposed to be a certain type size on the package. And the manufacturers of cigarettes discovered that if they made it even bigger, they would sell more cigarettes. And I think part of the reason is that teenagers in particular feel that they're invincible. I mean, I can remember, not worrying about death, dying, disease. Nothing could affect me. And that's the target of the cigarette ads for new smokers.
Absolutely.
Because they're killing the old ones off.
Sure. You're absolutely correct. And unfortunately, there still is and has been a stigma of looking cool, if you will. We still see it in the movies, and despite all the regulations that they have out there, people continue to smoke. It's amazing to me. I've asked patients, if I give you a pack of cigarettes or a loaded gun, which one would you rather have? Because they're both going to eventually do the same thing. but the addictive quality is so severe that it's very, very difficult. But the reason why I wrote the book was to help people educate themselves, not only with never smoking, but if you are a smoker, there are ways to quit. You need a good support system. There are medications out there that help. But more important, the most important thing I tell all my patients is that they have to want to quit. And when I give them statistics like 1 in 6 smokers will get lung cancer, or smokers live 14 years less than non-smokers, you can see a lot of patients' eyes well up when the thought of not seeing their son or daughter get married or see their grandchildren anymore, it starts to kind of take effect, and you hope that you're trying to prove a point, if you will, trying to help save someone's life.
So if somebody has been smoking for, say, 35 years or 40 years, and they stop, is that going to help extend their life?
Absolutely, because what I tell all my patients, for example, anyone that I'm going to operate on, studies show that if you stop smoking within 2 weeks of having anesthesia, which means that you have to be put on the breathing machine and then taken off the breathing machine, your body adapts to the smoking process. And when you take away the smoke that's actually hitting the lungs, you can see changes within 2 weeks. Now, the statistics show that you may never get back to what you would have been if you never stopped smoking in the first place. But with every waking moment that you stop smoking, you absolutely are helping your own cause.
The new trend is is vaping. Okay, the e-cigs, the e-cigarettes. We've discussed this a number of times on the show over the past couple of years, and I'm not a fan. I'm not a fan because I'm not a smoker, for one,
right.
And I don't like the smell, especially if it's a tutti frutti kind of a flavor that somebody is smoking.
Sure.
Is vaping bad?
The jury's not out yet on vaping. Let's be honest. Anything you're going to put directly into your lungs that's not fresh air can have detrimental effects.
Where do you get fresh air?
Well, well, it's actually not too bad here in the desert, to be honest with you. The smog and the dirt of New York City, which I left behind, and I know they have it in L.A. as well.
Right.
Is still there. But when you're talking about the oral fixation that people have and the addictive quality of the nicotine, anything that anyone can do to try to stop an actual cigarette and the toxins from going into their body, I will support. I tell my patients that smoking is like being pregnant. There's no in between. You're either pregnant or you're not pregnant.
You can't be a little bit pregnant.
You can't be a little bit pregnant. And it's the same thing with smoking. So when someone comes to me, and I've heard this question a million times, and says, well, can I at least vape? Well, if the alternative is to smoke cigarettes, then of course you should do that instead. And I think that obviously the studies will show later on that the risk of cancer is going to be higher. But if you're talking about actually smoking a cigarette, then I would endorse it, and I would tell someone if it helps them to kick the habit, then I'm a big fan.
With vaping, some people put nicotine in, some people don't. If it's just the water vapor and the flavoring and that oral fixation, they're using that to stop smoking or to reduce their smoking. Is that a good way of stopping smoking? Or as many of the ads that are circulating now saying that this is a gateway to tobacco?
I think that it's very difficult, and each individual has to be taken very carefully, meaning that if you want to stop smoking and vaping and counseling and having a good support group is going to get you off of the cigarettes and get you off of putting anything into your lungs, then I'm all for it. I don't think that there are any good articles or solid literature out there that says that it's a gateway to doing, to go from vaping to smoking, because obviously the person who is vaping is doing it for a different reason. And like I said, maybe we'll find out in 20 or 30 years from now what the actual effects are. I mean, remember when artificial sweeteners came out?
Absolutely.
It's the same concept. And nowadays, I feel like every time I pick up the newspaper or read online, there's a new article that tells us that everything from, chocolate to, the air we breathe to all different kinds of things are good one day and bad the next.
Yeah, so why don't you doctors get it together?
Because we're not that bright, that's why. But when it comes to lung cancer, there's an obvious cause and effect with smoking. As I mentioned in my book, there's an obvious role for removing toxic substances from your life. We all try to live healthy, but what's more important is my book deals with not just lung cancer, even though I'm a thoracic surgeon, which means I'm a chest surgeon, and obviously I deal with lung cancer and ailments of the chest and the chest cavity on a daily basis. But there are certain topics in my book that allow you to go into the doctor's office, know what questions you need to ask, know how to do some research beforehand that makes sense. And unfortunately, if you are one of those people that is dealing with cancer, whether it's lung cancer or any other kind of cancer, there are certain things that you need to know as far as obtaining a proper diagnosis, knowing what your options are, knowing what questions to ask your doctor. A lot of patients get frustrated because they feel that physicians nowadays don't have enough time to really answer all of their questions, and all I want to do is try to educate the public to the best of my ability.
Our guest is Dr. Eric Presser. He's got a new book coming out, An Empowering Guide to Lung Cancer. I believe it comes out in early October?
Actually, November 1st.
Oh, November 1st.
So,
okay.
But you can pre-order a copy on Amazon.com.
Got it. So you can go to Amazon.com. You can also go to LateNightHealth.com and see how pretty Dr. Eric Presser is compared to Daryl and me. And, he's a little bit younger than we are as well. Well, okay, he's a lot younger than we are as well. What about chewing gum? As, people who smoke have this fixation with doing something with their mouth and their hands. And is chewing gum a good one or not?
Sure.
Yeah.
Well, chewing gum, look, anything in excess is not going to be promoted or positive, right? I mean, if you're going to be chewing gum nonstop, then obviously I'm sure you're going to get a lot of calls from all the dentists throughout the country and say, what does the chest surgeon know about chewing gum? But you have to look at the risks and the benefits and all of the alternatives. It's kind of like when I have a patient who has stage 4 lung cancer, and stage 4 means that it's spread. It's spread outside the lungs, and their only options may be chemotherapy with or without radiation therapy, and there are certain procedures.
We are running out of time for the segment, so what we're going to do is we're going to pick up in just a couple of moments. Our guest, Dr. Eric Presser. I'm Mark Allen. The Insane Daryl Wayne is in-house, and we will return. Be sure to join us at LateNightHealth.com, LateNightHealth.com.
If you or someone you love suffers from drug addiction, now is the time to utilize your private health insurance PPO plan. If eligible, receive up to $30,000 or more in substance abuse benefits with low or no out-of-pocket cost. We are the National Treatment Network, the premier drug and alcohol treatment referral service operating 24/7. We help connect you with facilities nationwide that accepts PPO private health insurance for substance abuse. If you have PPO substance abuse coverage and you need immediate admittance to a medical detox or residential rehab treatment center, call us now. Call our live referral helpline today. The call is free. This program is not available to Medicare or Medicaid customers.
Call 800-296-1252. 800-296-1252. 800-296-1252. That's 800-296-1252.
Are you being audited, and do you owe the IRS $10,000 or more in back taxes? Is the IRS threatening to take more of your money? Don't fight the IRS alone. The Tax Doctor is here to help you negotiate a lower tax bill. The IRS can freeze your assets and seize your bank accounts, but you can stop these IRS actions. The Tax Doctor will fight for you using industry secrets that can stop any IRS actions, eliminate penalties and interest, and reduce your past tax bill so you pay the IRS less. If you owe $10,000 or more in back taxes, call the Tax Doctor now for a free IRS audit emergency review.
800-663-5107. 800-663-5107. 800-663-5107. That's 800-663-5107.